Well, let's go ahead and get started. Namaste and good evening, everyone. My name is Samir Kalra. I'm the Managing Director with the Hindu American Foundation, and we have a really special webinar for you this evening as part of our Namaste Healthy webinar series. Tonight's focus is going to be coping with COVID-19 and the rise of cyberbullying, examining interactions during isolation. We have a panel of medical and education experts that you're going to hear from in just a few minutes. But before I introduce them and pass it on to them, I did want to go over a few housekeeping items for tonight. We will be taking questions and answers at the end of the program. We will leave enough time for that. So please do use a question and answer function at the bottom of your screen to type in any questions that you may have, and we'll make our best efforts to get to everybody. Unfortunately, we will not be able to call on anybody if they raise their hands or unmute you or enable the chat function, just due to the large number of people that are going to be in attendance this evening. And also wanted to just give a legal disclaimer before we get started that although we do have medical experts with us tonight, that nothing that they say should be construed as medical advice. For any specific medical advice in your own situation or questions that you may have, please do consult your healthcare professional directly. And without further ado, I want to go ahead and introduce our panelists for this evening. Our first speaker is Dr. Abhay Dandekar. Abhay Dandekar, MD, practices general outpatient pediatrics and has served in a number of educational and leadership roles in the academic and community settings. Dr. Dandekar serves as a medical director for population health at Optum United Healthcare Group. He is an associate professor of clinical pediatrics at the University of California, San Francisco. And joining Dr. Dandekar on the panel will be Dr. Dhara Meghani, PhD. And Dr. Meghani is a licensed psychologist and professor in the clinical psychology PsyD program at the University of San Francisco. Her research concerns the promotion of infant and perinatal mental health through the design and implementation of accessible, evidence-based interventions aimed to reduce stress, anxiety, and depression during the transition to parenthood. She is founder of Parent Line, a telepsychotherapy counseling service for parents of children from birth to 3 years of age. And moderating our panel is our Director of Education at the Hindu American Foundation, Dr. Shireen Bhala, PhD. And with that, I'd like to go ahead and pass it to Dr. Dandekar.
Let me share some of the excellent recommendations from a number of bodies. And I think all of us are trying to really understand a little bit more about what the new mode of operation is going to be, so to speak, in our homes. Part of that is really trying to cope a little bit with how do we manage and meet expectations for ourselves, for our children, for all of the various components of that. So I'm going to be trying to share today a little bit about cyberbullying in children and teenagers, particularly from the medical aspect and from the pediatric aspect. Both as a sort of preempt for this, both cyberbullying and bullying are not new, but since we are in a lot different times, particularly related to isolation in the home, and hopefully not social isolation, but real physical isolation, it's a task for all of us, particularly as parents. But I want to also preempt some of the things I'm going to mention in that bullying and cyberbullying are not limited to kids. So making sure that all of us are sensitive to how this works is going to be important. As I go forward in talking about this, I want to make sure that we are really sort of familiar with how we are becoming more comfortable with scenes like this, where normally where we have maybe children playing and having conversations, perhaps what we're more restricted to is going to be scenes where they're engaged, but they're certainly engaged with devices, engaged digitally as opposed to in the physical world. And these are probably familiar scenes in many of our homes right now, perhaps a little bit too much or not, but this is definitely what we're all coping with. From that standpoint, let's go through a couple of definitions first. So just to understand what bullying actually is. Bullying is any kind of unwanted, aggressive behavior among children. And like I mentioned earlier, this can happen for children, for teens, for adults, but particularly from a pediatrics standpoint, for children and teens that involves a real or perceived power imbalance. So we really want to understand that bullying is where there is a power differential and people feel like someone has power over them, or one person may be exerting power over another. Cyberbullying, for that matter, is really that same concept, but it's now taking place over digital devices, cell phones, computers, tablets, certainly, and the content that's going through these devices is really where cyberbullying can take place. So again, cyberbullying is mostly defined in three different sort of categories that are important for us to recognize. One, it can occur digitally where people can view, participate in, or share any kind of content. So this includes really sending internet-based content, posting anything, sharing negative or harmful, false or mean content about someone. Certainly, it can include sharing any personal or private information about someone else, maybe not necessarily from the child or teen themselves, but information that is in regards to a friend or someone else they may or may not know, causing, of course, embarrassment, humiliation, anger, really a lot of stress. Some cyberbullying, by definition, crosses the line into unlawful or criminal behavior. So please be aware of that and have a low threshold, of course, to try and report this. And we'll get into that in a moment. Probably some of the more common places where cyberbullying occurs is going to be in social media, ones that we're all familiar with, certainly Facebook, Instagram, Snapchat, Twitter. There are new products and new modes of this that are coming out every day, particularly as we're in this era. So House Party is a new one that's out there. So really sort of understanding what the different platforms are is important. SMS and text has been an important method of communication, and also where cyberbullying can occur. Instant messages, probably the most easy example of this is WhatsApp, and of course email or any websites that are out there. So these are common areas where cyberbullying is going to occur. The one thing about cyberbullying that's actually pretty critical is to understand that personal information and content can be shared, and it may be visible either knowingly or unknowingly with strangers or people that the child or teen might be familiar with. So it's important to recognize that this is really the power of what the internet is that information is available now to people you may not know, may not be familiar with, and it may actually be visible whether you know so or not. Cyberbullying can be persistent because digital content and access is always available 24 hours a day, 7 days a week, and 365 days a year. It may be hard to find relief from that digital content. So it's very persistent. It can be overwhelming for that matter. Cyberbullying can be permanent. If not reported or removed, most digital content is permanent and it's public. And cyberbullying can be very hard to notice. And particularly because in this new era, we might be having new conversations with our children and our teens. We may not completely notice their behaviors, their patterns. So we may not necessarily be directly seeing any of this content. And most importantly, it might just be simply hard to recognize. I think some of the ways that bullying and cyberbullying are different are also important to recognize for parents and for family members. You know, when bullying is happening in person, it can involve sometimes physicality, it can involve verbal abuse, but people are around to notice it. It's actually easy to identify who is doing the bullying and who is receiving the bullying. Cyberbullying is a little bit different. It is notorious for being anonymous. You may not know who the bully is. You may not know who the bullies are. There may be one or more victims of the bullying. And because of that anonymity, it's a little bit different, of a topic to address in that way, or to have a conversation with, because it's sort of an anonymous target and an anonymous perpetrator. Cyberbullying can occur at any time. It's not limited to the schoolyard or to recess or to times after school or to a sports event. Because it can occur at any time, it's important to understand that this is not limited by a location or a time for that matter. And then I think the power of the internet really sort of makes this a very different scope and scale of things, where that cyberbullying can be passed along very, very quickly and shared very rapidly. So in the photo you see below, 6 kids who are independently on devices now magnify that and amplify that by several hundreds, thousands, millions, where a particular tweet or a particular video or a particular message can really, really be amplified very, very quickly. So this can, of course, be very disheartening to anybody for that matter. Cyberbullying and bullying carry the same level of health effects. And it's important to really understand perhaps what kinds of health effects are out there. So certainly anything that's evoking a stress response. And a stress response can be anything that's now activating or challenging the body's regular fight or flight responses. And those can manifest in a whole host of different ways. So there can be headaches, there can be digestive issues and abdominal pain, muscle aches and body aches, fatigue, just feeling tired in that way, appetite and weight changes, particularly after a hard event. And this can be relatable in the work environment, in the school environment, in the family environment, but all of these different physical effects or symptoms for that matter can be a result of cyberbullying in particular. What does it result in? Well, we know that if your body is having a sustained stress response, it can actually alter your immune function. It can alter your ability to fight off infection and disease. And particularly during a time right now, like we are all experiencing with the coronavirus, our immune system and how we can respond to diseases and to illnesses is premium and is very important. We're going to hear from Dhara in a few moments about some of the mental health issues and mental hygiene issues that are involved here, but behavioral cues are important. So increases in use of a device or emotional responses that don't seem completely consistent with who your child or your teen is, being evasive or hiding a device, in some of these cases are important cues to recognize as well. Sometimes you might notice that these behaviors tend to be brand new, or they tend to be persistent in particular situations where an email account now has become discontinued, or frankly, just avoiding common social situations where previously the child or teen was happy and saying, I don't want to do that anymore. So mental health issues we'll hear about in a few moments, but some cues especially if they're correlated to some of these other health effects and symptoms, that's also important. Now, the long-term or prolonged toxic stress or stress response can result in profound later effects. So it's not just simply the cyberbullying that's happening right now, but it's actually now going to translate to some of the effects that we'll see later. So substance abuse, heart disease, diabetes, obesity, anorexia, many long-term issues are related back to some of these effects. This is a very powerful graphic that talks about adverse childhood experiences. Cyberbullying and bullying absolutely fit into this category of creating adverse childhood experiences. And if they are not addressed appropriately, you can actually start seeing what those effects are long-term by marching up this pyramid where you have disrupted development, lots of social and emotional impairment, later on risk of a healthy risk behaviors or risky health behaviors where you're seeing substance abuse or other kinds of harmful things. And then the relation to disease and disability with early death as the most grave after effect of this. So how do we address this as parents? How do we actually become more attentive to this? And it's not easy. I think recognizing that it's not easy is probably the most important factor, and doing this as a team. So use yourself, your family, your kids as your great resources, and of course your medical and mental health professionals. So be attentive to all the physical health cues I just mentioned, as well as the behavioral cues. Be very supportive of your child or your teen. Try as much as possible to generate trust. Try as much as possible to generate conversation. It's actually important to have periodic, if not sustained, conversations about this where you once found that you were not talking about any of this because you didn't have time during the day, all of a sudden now that everyone is in the same place together, hopefully you can make conversation happen gradually, but in an important way. I think reporting the incidents or behaviors, particularly to school authorities or police, can be an important factor as well. And having a low threshold to do that, you'll get some guidance actually from those folks who have experience with this, particularly in law enforcement or at the school. It's actually very critical to document the incident. So evidence, screenshots, understanding what the content is can also help you to address it and deal with this. One vote of caution that we in the American Pediatrics recommend is be careful not to focus on restricting or taking away the device or the time, as the child or teen may feel much less confident or trustworthy in a parent or a caregiver, particularly in the future. So you want to have trust. That's probably the most important way to develop dialogue. And then last but not least, seeking help from your medical mental health professionals, from your school professionals, from law enforcement as well. Why is this so important right now? Well, we have seen a dramatic upswing in the availability and the use of digital devices and content. We've seen dramatic change to our routine and daily life. We have a higher focus of our own needs as parents. It's hard to work from home or do your job as an essential provider and at the same time be attentive to your children and your teens all at once. We don't have the kind of structure and surveillance that a school provides or that regular activities may provide. And unfortunately, we have seen an increase in xenophobia and hate crimes and crimes against folks who may or may not feel like they are the victims of displaced blame. And so that's actually providing a lot of substrate for this. I think the last pieces here are to stay supportive of those social connections, but be mindful of the content and method. Some strategies would be to say, listen, if we're going to use a device, let's try and talk on the phone. Let's try and have real-time visual content. So FaceTiming and Zoom and things that we can actually are sharing more of the visual and the behavior can actually be helpful, and they can actually involve groups. So these are the easy things that we can participate in as parents and as teens and kids together. And we want to strengthen our routines and our physical activities. So doing things as a group, playing games, taking recess together as a family, doing yoga together, actually any kind of routine would be very helpful. Talking about our login habits and monitoring our activity, have that conversation, and be careful to exercise boundaries and rewards. So we don't want to use a lot of negative reinforcement. We want to reward people for using media and content the right way. And here's one that I think all of us could do, and that is before we post or before we tweet or before we email, pause for a few moments. Let's examine what it is that we're sending, what it is that we're about to receive. And then we concentrate, of course, on building a lot of self-esteem. I think that's probably the key factor here as well. So I appreciate sharing this. I'm looking forward to answering questions at the end, but I'm also very grateful to now pass this on to my co-presenter, Dhara.
Great, thank you, Dr. Dandekar, and I want to now transition over to Dr. Meghani for a discussion on some of the mental health aspects of cyberbullying.
Great. Good evening, everyone, and thank you, HAF, for holding this important and topical webinar tonight. Thanks, Dr. Dandekar, for an informative presentation, and to Samir for the introduction. Let's see. All right, there we go. So you've heard some very helpful recommendations and information from a medical perspective, and I'd like to provide some thoughts from psychology and development about this topic. I'll start with a very brief description about the current context, since that was just covered, but really focus a little bit more on the developing adolescent brain, which we know is particularly vulnerable to cyberbullying. Then I'll discuss some reasons that cyberbullying occurs and how it impacts children's mental health, and wrap up with some additional tips around prevention and coping. So I'm opening here with the current recommendations by the American Academy of Pediatrics and the World Health Organization about screen time. Now, these have been updated in 2019, certainly before COVID-19 was a big presence in all of our lives. And you might be chuckling to yourself as you look at this screen because nobody is able to actually adhere to these guidelines right now. You can see that even for the school-age children, the limit or kind of the recommended limit is up to 2 hours a day. And we can assume that the AAP and WHO were really thinking of children being in school for most of this time, most of the waking hours, and that these 2 hours or so that teenagers are engaging in are really beyond school and more for entertainment or leisure activity. There are actually not specific guidelines in place, which some people have criticized, but there aren't guidelines in place for teenagers beyond the age of 13. Generally, the recommendation, again, is to limit screen time to about 2 hours when it's not for educational purposes. So I wanted to just start with those guidelines to show that we're living in a very different reality compared to what authorities and health professionals have suggested. And in fact, this study that was done in 2019, just in October, again, before COVID struck, found that actually 8 to 12-year-olds reported spending about 5 hours a day on their screens, where teenagers about 13 to 17 spent really 8 hours or so. And this is, again, not accounting for really school-focused activities, but for entertainment and on all kinds of various apps. Now, Dr. Dandekar already spoke a bit about how COVID-19 has impacted families. We know that about 97% of school-going children are currently engaged in distance learning. That also means that they're not engaged in any sort of group extracurriculars. For many students, they have limited time outdoors depending on where they live and what kinds of privileges they have. And their parents are working very hard as they juggle multiple demands, whether they are an essential worker and outside risking their health or working from home while balancing childcare and trying to be a homeschool teacher. So all of these factors have inevitably resulted in more screen time for children. We know then that because of this, children and parents might be experiencing a multitude of challenging emotions that range from being bored to being resentful to experiencing grief and loneliness. And oftentimes screens can feel like they're one way to kind of shield away these challenging emotions. But we want to stress again the safe and kind of practical use of screens and be thoughtful about how to address these emotions in more productive ways. So how do we interpret these recommendations in a very unprecedented time? It's important to have a conversation with your children, sit down and be direct and say, this is a different time. And so screen time rules, even if you've never had them before, this might be a good time to start implementing some. Screen time rules may be very different than certainly what they were before. Many of you might be used to doing this when you go on vacation, or you might say, okay, screen time rules kind of go out the window when we are on a flight because you can watch as much TV as you want. We need the kids to stay in their seats. Again, this time is asking parents to be thoughtful about how to make those rules in their household so that they're both flexible and allow for extra screen time that is both for educational purposes as well as spent in quality ways interacting with family and friends since we're not able to see each other in person, as well as in ways that are potentially stress relieving. The World Health Organization has actually encouraged the use of video games as one way for stress relief. Now, you want to be thoughtful and practical about how much time children might be spending on video games and what type of video games they're playing. But again, they too are recognizing that this is a different time where we might need to change the ways that we've typically advised parents to work with children. There are some really wonderful mindfulness and meditation apps out there, as well as more simpler stress relief apps that might work better for younger children. like color by number. And so those kinds of things can be okay to use during this time as well. I certainly wouldn't recommend counting if you have a limit per day to count video calls that are interactive, or for example, like a family movie night should not count towards the total amount of screen time. And then of course, we want to emphasize non-screen activities, just as was emphasized by Dr. Dandekar, is, take recess, take a break together, and I'll talk a bit more about some ideas later on. So in addition to understanding our current context, it's important to know what's happening developmentally with the adolescent brain. And this is because our focus is so much on tweens and teens and how they are particularly susceptible to cyberbullying, both as a victim and as a potential bully. All right, so what's happening during adolescence? Parents, if you have an adolescent, some of this will hopefully feel familiar. Biologically, this is a period of immense change, second really only to the developmental period following birth. There's a lot of neuronal pruning that's happening to kind of refine and strengthen the connections in the brain to allow us to be faster and more efficient humans, ultimately. How does this all get reflected psychologically? Brain structures develop at different rates, and so cognitive and emotional control end up oftentimes on different wavelengths during this period. Adolescents are prone to what we might call thinking errors or errors in judgment, and they really have some difficulty making good choices. It's not just that they don't want to, they sometimes are limited by their cognitive abilities. They also have challenges inhibiting or curbing impulsive behavior. So again, that recommendation of pause before posting is so important here. And really consider how can you help adolescents inhibit that desire to either say something back to a friend that might come across in the wrong way, and they just haven't really thought that through. Partly because their brains haven't developed or matured as fast as their bodies are. Socially, we know that this is a time when peers really become a bigger part of the pie than parents are in terms of perceived support. And naturally, this is going to co-occur with more frequent disagreements at home with adults and testing limits. And then culturally speaking, certainly in this country, adolescence has been lauded as a time when children can take risks. They're encouraged to experiment and make mistakes and define themselves, but it's important to remind children that mistakes that are made online are very hard to erase. Certainly, there's also a lot of pressure from schools and families to succeed and to become increasingly independent. So you can see that there are just developmentally so many things going on for adolescents that might make them more prone to be a victim and also potentially a bully. So why do children engage in cyberbullying? We just went over some of these cognitive limitations, which include the belief that they're not going to be caught, that they can kind of hide behind a screen and no one's going to kind of find out who did it. And that oftentimes can be the case where a lot of bullying happens anonymously. There are many children who desire to be noticed, even if it's negative attention. They might desire to fit in or become popular with certain peers. And we know that there is an effect of some children actually joining bullies to avoid being bullied themselves in certain friend circles. And certainly for some children, when they're bullied at home, the statistics do show that they're more likely to bully their peers at school because they've really had no power or experience of being in charge at home. Low self-esteem is oftentimes a big component, as was covered earlier. They may believe or somehow maybe have been told that they're not good enough, they're not worthy of attention, and so putting down others can sometimes help them feel better about themselves. Some children who are cyberbullies may have underlying symptoms of depression, anxiety, or chronic trauma, and sometimes maybe retaliating largely because they're inaccurately assessing how others are responding to them. So they may perceive someone, a peer, for example, as being hostile or aggressive, and that might be based on a traumatic event that has occurred in their past. And so their bullying may be a reaction. Common mental health consequences include experiencing depression, anxiety, and maybe even post-traumatic stress. I'm going to cover here a few symptoms of depression, but there are many more that can occur. One thing to note is that for children, the classic symptom of depression, which is low mood, may actually manifest as irritability. Now, how do you parse that out from an adolescent who might just be naturally irritable during this time of development? That's really challenging. But again, note if there have been significant changes in their behavior, whether it's, the amount of time they're spending online, or maybe even time they're not spending online. They might be avoiding certain things because of what has happened, and may react in ways that are very different than their norm. The other piece here related to poor concentration might come out in their academic performance. And so it's a good idea to stay in touch with teachers. This is, of course, a very hard time for students to remain engaged when they're doing distance learning. See if you can have a mini conference with a teacher if you're worried about your child's academic performance, and particularly if it seems like it may be due to poor concentration or worry about other things going on in their friend circle. Suicidal thoughts are common for children who are cyberbullied, and we don't want to take this lightly at all, particularly in this time. And so you may hear adolescents say things like, I don't want to be here anymore, this is the worst time ever. Talk to them about that. Be empathic and try to understand what they actually mean by that. Do they have an intent to do something, or are they really expressing frustration and just need someone to vent to? Social anxiety can occur, and we can see this happening even when we're social distancing or physical distancing. Again, children may be reluctant to go back onto a social media platform, which might be okay and self-protective to some degree, but you may see this happening as they fear becoming a target again. In terms of experiencing potential post-traumatic stress symptoms, this may manifest oftentimes in the form of nightmares, or you might notice that children are kind of zoned out, what we call dissociation at times. They might just seem really lost in thought because they're ruminating about what has occurred. When a child has experienced cyberbullying or something very traumatic, especially at a chronic level or in a way that has been very shocking, they might start to have negative views about the world. This is not a safe place anymore. Nobody cares about me. I'm not worthy of being cared for. Those are some things that might be running through their minds. And certainly they may have difficulty experiencing positive emotions. And so don't be surprised if you try to kind of snap them out of it and it's just not working. Again, another unfortunate side effect of all of this is that during our physical distancing, what we would consider an instructive and protective climate of face-to-face peer interactions is no longer available to teens. And so, one thing to consider here as well is that children are more likely to hide what's occurred to them if they have if they feel like their parents aren't going to understand, right? This was discussed earlier in terms of the importance of communicating with your child and letting them know that they can come to you. And still, surveys have shown that children tend to share more with peers than they do with their parents when they're cyberbullied. Some of these reasons are also because they themselves want to appear strong, independent, I can handle this. They may also be concerned about losing their electronic device privileges. And so again, another way for parents to make sure that they're communicating transparently is to start that communication channel now, even before you would imagine any incidents of cyberbullying have occurred. So we'll talk about a few strategies here and then wrap up before we take more questions. Prevention is the best medicine. You want to encourage safe and moderate use of devices. And if you don't already have a technology contract with your child, this is a ripe time for it. There are really wonderful templates available online, even if you just Google technology contract. But we've provided some resources at the end of this presentation of websites that have these templates available for you. It might seem a little cheesy initially, you know, you might have to kind of pull your children on board, but if they collaborate with you, they're more likely to actually go through with it and adhere to the guidelines that you decide on together. Think about where you might establish screen-free zones and times. You know, there may be a place like the kitchen table or during mealtime where everybody puts their device away. You know, and you can turn it into a bit of a game. And even as a parent, maybe even if you forget, admit that you made a mistake. Get to know what apps are popular with your child, you know, get some interest. I know that as a parent myself, sometimes I feel like I'm behind on what is coming out these days, but it's really important to show interest, to have your child actually show you what the app looks like and what they can do on it and what they can see. And certainly don't be afraid to do your own research on the app if you want to learn more about it. It's very important, you know, I know that in various cultures, being direct is not always a strength. And at the same time, if we don't do it proactively, it's going to be much harder to kind of manage the aftermath of cyberbullying. So this is a great opportunity for parents to sit down and talk to their children in positive ways. And I've really highlighted here some phrases that help parents think about how to do this so that their children don't feel like their parents are suspicious of their activity or don't trust them, but really that they trust their children, that they encourage them to come and talk with them, particularly when things are challenging, and to remind children of their own strength and their resilience. And, you know, think about ways to reduce screen time as much as sometimes it's not possible given our current situation. It certainly may be harder to implement, but we find, especially in the psychology world, with behavior change, it's much easier to add things than to subtract. And so consider some alternatives to screen time. And here are some ideas for you. I'm sure you can come up with many creative options within your own families. Dr. Dandekar covered a lot of the piece around what to do when cyberbullying occurs, but here are just some points that you can emphasize with your children, particularly around documentation and not deleting in the case that reporting is going to happen, and to ask and remind children to reach out rather than retaliating or responding immediately. For parents, it's important to really take a breath, pause when you hear the news that your child has been cyberbullied. It's easy to want to overreact, to call that other child's parent or to contact the school or even the police. Gather the facts, you know, consider reporting the incident. There's a wonderful site that has a lot of resources called Cyberbullying Research Center that has many different fact sheets, and we'll provide the link at the end of this presentation for you, but they provide some guidelines around reporting the incident, as well as this last point around, you know, the bottom line should be to stop the bullying. It's not about blaming the perpetrator or blaming the victim, but really thinking about how can this stop so that my child doesn't have to go through it anymore. And so parents can partner with schools, with teachers, with therapists and counselors as needed to take charge in that process. Okay, so this was a very quick overview of some of the current concerns that parents might have related to increases in screen time lately, as well as a little bit of psychological and developmental information that can help support children's mental health in the wake of cyberbullying. I sometimes find this reminder here very helpful when I work with parents, because we know that there's oftentimes a lot of guilt involved when, you know, we're working hard and children just want to have one more TV show, or they want to be on the app for a few more minutes. A good friend of mine and a local pediatric advice nurse reminds us that when your children live under your roof, you are in charge of how much screen time they get. And certainly that can be a collaborative process, especially with older children. And a natural corollary that I will add is that parents are also responsible for the amount of screen time that parents get and ultimately model for their children. So we hope that this information was a helpful start. There are many other resources available to you to manage cyberbullying, and I'll kind of pause there so that we can open it up for questions.
Great, thanks, Dr. Meghani, so much for that. And I think we're going to pass it back to our moderator, Dr. Bhala, to kick off the discussion with our panelists. And I also want to remind everybody that please do feel free to put any questions into the question and answer box at the bottom of your Zoom window, and we will try to get to as many questions as possible. We do have about 18 minutes left, so hopefully we can get to any questions that come in. Dr. Bhala?
Yes, thank you so much, Dr. Dandekar and Dr. Meghani. That was an excellent presentation. You both mentioned resources, so I do want to go ahead and preemptively say we will share a list of all the resources on our webpage after the webinar is done. So we've gotten some great questions, and I wanted to start off with a question to both of you. You both have mentioned the amount of stress parents may feel at this time allowing their children to use their devices. What other strategies could you give them? I know, Dr. Meghani, you mentioned parents not feeling guilty, but what as a parent could you do to help mitigate that stress?
I'll go first. I think that probably being transparent and honest is probably the most important backdrop to this. Recognizing that it's not easy yourself. I think Dr. Meghani, really talked about the power of understanding how much control you have over this, but then also really the humility to recognize that we as parents are going through the same thing with putting restrictions and limits on ourselves. Stress is a difficult thing to manage, and first having some coping mechanisms for yourself that involve really, having great conversations and building trust. And really, I think finding activities and engagement with your family, your kids, that will in some ways de-stress together. So it doesn't have to be that you compartmentalize that the best way I'm going to de-stress is to have breathing exercises and do them myself. This is a great opportunity now to try and do this together with your kids, so you can actually model great habits and really address particularly the notion of the developing adolescent brain, that things can be done in a group, and they can actually have some great comfort in that, and hopefully that'll actually solve some of the stress issues for parents as well.
Dr. Meghani, do you want to add anything?
I think those are great recommendations. I would agree that I think going back to the piece of adding non-screen time activities is a really good way, and doing them together, right? So I think the piece around guilt here is that I'm on my screen, you're on your screen, we're sitting right next to each other and we're stuck in this house together, but we're not really interacting. And how can we remind families that they can take time away from their screens, and that this is the reality, unfortunately. I mean, parents are having to work. They need to make a living if they can, and children are having to be online in order to get their education. And so planning out time and really sticking to it in terms of a routine. I think Dr. Dandekar mentioned that earlier as well. It does not have to be a very detailed routine. It can just be, at 3 o'clock on Saturday, we're all going to say pause and we're going to go for a hike. And so it's it sounds idealistic, but when it's actually implemented, I think everyone feels a little bit better about themselves and better in general, mentally, physically, if they can do something that they committed to. And so the guilt will probably remain, but it can be offset by introducing activities where you can really be with each other. And that's been a challenge, you know, even for me as a professional and knowing about this stuff. It's hard unless I very intentionally put my phone away, close the computer, and really just sit down with the kids.
I want to just add one quick piece to that incredibly eloquent discussion that Dr. Meghani just outlined. As someone who has 2 teen housemates myself, I think one important extra step that we don't always do is when we're having a conversation and we ask a question and our child or our teen gives a very quick, simple response, ask the follow-up question. Don't simply retreat back to your phone, because the hardest part to do is to carry on a conversation. So don't let it necessarily end and die, because what that does is that, of course, it forces people back into that habit of saying, okay, that was a one-word answer. I'm going to go right back to my phone and retreat back into the comfort of the safety of what I was just doing. So I think it's important. I appreciate this idea of, scheduled times but if you are even having a simple conversation at the dinner table, ask the next question. Keep that conversation going. Don't let it actually end.
Yeah, great. A lot of great advice there. Kind of sticking on that same theme about parent and recommendations for parenting, we have a great question here about, can you recommend some good video games that relate to Hindu culture and heritage, or ones for any culture that do not promote violence, since we believe in ahimsa or non-harm? I don't know if anyone.
I'm not as familiar with the video games that are out there, honestly, at this point. I don't know, maybe having some teenagers in the home, Dr. Dandekar, might be.
I think, it's in some ways, on the one hand, I think it's important, more important than the actual content, which is incredibly important, right? We want to promote great messaging and content, no matter whether it's a video game, a movie, a shared screen that you're watching. I think more important than that is actually participating. So just like Dr. Meghani mentioned, that we want to know what apps and what sites that our children and our teens are using. We want to know what games they're using as well. So starting out with the, hey, let me understand what those games are. But if you're looking for what will be a good nonviolent segue or bridge into our culture and some of the principles and practices that we try and espouse, then those games that maybe involve puzzles or building things, or games that are really involving activities. So people play Twister online, or they have word games or Pictionary kinds of things. I mean, anything that really is interactive, intellectual, and nonviolent. And it may require actually for each family to go through some of their preferences and understand that. But in fact, that's a great opportunity for discovery for a lot of parents to really see what's out there.
Yeah, absolutely.
Right. I'll just jump in here really quickly to say we had, on a personal note, my cousins and I did a family game night over Zoom just over the weekend. And there's something called the Jackbox, if someone's looking for a recommendation. And that actually, it's like a party pack of games that can be done over Zoom. Everyone plays with their phone as a remote control. And what I'll say, beyond the nonviolent piece and having things that challenge you cognitively, find games that provide comic relief. We all could use a laugh in these times. And sometimes it's hard to do that with everyone that you're living with, because we're all just kind of in our own worlds and we've set into this new holding pattern. So if you are going to be interactive online, think about ways to laugh as well. And that might include, watching a comedy segment that's age appropriate, or even just for the parents to do that after the kids go to bed so that they can feel a little lighter among themselves.
Yeah, great, great. I know my brother, sister, and I have been getting into back into Words with Friends to kind of keep interaction going. Good. So another question that's come up is, Dr. Dandekar, you mentioned not to take away devices when disciplining children and if they are the aggressors in cyberbullying. But what do you recommend to do if you're finding that they're using their devices inappropriately?
Yeah, I think, you know, obviously there are age-appropriate methods for this, and I wish I had a absolute right answer. It's sadly not like trying to pick the right medicine for an ear infection or something like that. So, but I think, you know, doing two things. One, for the younger kids, I think really re-emphasizing the idea that, you know, as a parent, you are the one responsible for the guardrails. So if it's not appropriate for your child to have a smart device, they shouldn't have one. You control that, and that's important. When it comes to setting up boundaries of screen time, even before incidents or sort of negative things happen, I think that's also incredibly important to think about those guidelines about what appropriate screen time is and whatnot. Part of the reason for not using the negative reinforcement of removing a device or taking away you know, the time, it is so that it won't become such that there's a punitive response and that the child or the teen now develops a distrust in being able to disclose a difficult incident that is out there or that they've experienced, or for that matter, for them to disclose to you what they have been engaging in, but rather instead of necessarily changing, you know, the device or restricting it, perhaps you need to actually change the method or the content or the style with which it's being engaged in. You know, I remember pre-COVID and coronavirus talking to a parent specifically about this to say that, you know, when they were setting up a social media account, it was a joint account. So they were co-parenting or for that matter, co-engaging with the time or the device itself. But the real reason to do this is to not you know, have an erosion of trust. So for that matter, the strategy or the method for this would be anything that can actually help build that trust up so that bullying incidences or cyberbullying incidences can now actually be shared and they won't be a secret.
Anything you want to add, Dr. Meghani?
I might just say that in the instance that you do need to remove, you know, internet privileges, you know, when something very severe has occurred, you know, have children understand that this is something that is a privilege and that they can earn back. And so setting up a system of good behavior where they can kind of demonstrate that they're capable of managing this type of device, you know, might be, this might sound a little hard to do as a parent, but, you know, asking the child to write something, write an essay about, you know, phone use, do your own research about cyberbullying or using inappropriate kind of language online. Whatever the, you know, the infraction is, you know, have an appropriate consequence to that, and have the child not just see that you're taking it away, but again, as we would for younger children, for them to try to understand, why am I in a timeout, for example, right? Why did my phone get removed from me and how can I earn it back? Taking it away for an extended period of time, especially now, is probably likely to reduce, you know, their trust for you, as was just mentioned, but also to impact their mental health in negative ways if they're not able to communicate with friends. And so think about what a reasonable period is and kind of problem solve together.
Great, great. I know we have time for just one more question. So as things hopefully find new footing and students are able to go back to school, how might you as a parent begin to start to decrease screen time? And what are positive strategies in starting to move away from the 5 hours a day that you quoted?
Yeah, hopefully children will be ready to rush back into their normal lives and be okay with not having as much screen time. But I'll go back to that chart that I mentioned earlier in my presentation. Those are certainly aspirations and not requirements, but it can be important to review especially with, you know, slightly older children who can go over that with you to kind of think through what's a reasonable amount of time, given the limited time of the day and the fact that they're back on kind of track, you know, and have them think through with you, what are some of the things that they kind of did instead of social interaction or exercise or being outdoors, and how can, you know, how can they get back on the wagon for those things so that screen time then naturally gets reduced.
Dr. Dandekar, did you want to add anything?
Yeah, no, I would echo all of that. And I really think that this is going to be a frame shift, not only for kids and families as we slowly but surely exit from this, but I really like that idea of revisiting why it is that this matters, and reflection, especially for the older child, is going to be great. And if it's a younger child who can't actually reflect upon this, then the strategy really is the reflection that we can do as parents, right? So, what was so fun about us all having food together, or playing that Zoom game together, or exercising together, having a really great conversation, or that experience. And I would say that it doesn't necessarily have to always be about the black and white of using a device or not using a device, but rather reflect upon, look how we did smartly use this device. How did that behavior change as well? I think the idea where we're going to somehow all have our kids and all of us go back to work and we're not going to be using any devices anymore it's just not reality. But being able to say, look how we changed our behaviors during the crisis time, and make that the behaviors as we go forward.
Great. Well, I know we're just at time, so I want to thank you both again for presenting and sharing with us. It was a very, very informative discussion. I want to thank all of our participants for attending today. This presentation will be available on our website along with the list of recommended resources from both Dr. Dandekar and Dr. Meghani. If you have any questions, please do email us at education@hinduamerican.org. And thank you again for joining us this evening. Thank you.
Thank you.
Thank you so much.